We know a lot of you have coronavirus questions out there, so our Spokane city and county leaders are coming together to host a town hall tonight to answer some of your top questions. So we've got included Spokane Mayor Nadine Woodward, Dr. Bob Lutz from Spokane Regional Health, Spokane Valley Mayor Ben Wick, along with County Commissioner Al French and State Senator Andy Billig. All are there right now answering your questions. If you'd like to participate, you can call the number that is right there on the left side of your screen. You can also ask the response team questions on Facebook or Twitter. So we want to go back to the live Q&A session right now. Let's listen in.
The reality is we are stopping people for speeding. So if they're speeding, we find that happening. We do stop and we do issue tickets. The one thing that we are trying to do, though, is to make sure that we're maintaining social distance and doing the best we can to protect both the deputy and the person that we're in contact with. So speeders, if you're out there, we are making those stops. I'd like to address the question, I think 2 questions ago. I just looked it up. LA is not stopping and giving anybody tickets for being out and about. That's a myth.
All right, thanks for that answer. Let's get our next question up right away. 1 second. We've got Gretchen up live next. Gretchen, looks like you got a 2-part question. Go ahead.
Yes. My first part of the question is there a number locally that we can call or a place we can email to get immediate answers to our questions rather than just going online and looking at the frequently asked questions, because it doesn't answer this question I'm going to ask now. If we get COVID-19, has there been any research on what makes a difference between those that survive and those that don't? I'm not talking about pre-existing condition, because I know that's one of the differences. But are there certain behaviors we can do that will increase our chances of surviving? And I know one of the issues with COVID-19 is inflammatory or inflamed organs or whatever. Do anti-inflammatories help?
Thanks for the question. This is Dr. Bob Lutz. With respect to the second question, there's nothing that I've seen specifically around anti-inflammatory elements that necessarily protect. We do know, however, that chronic inflammation is not good, and we see that chronic inflammation exists with a lot of other medical problems. With respect to getting immediate information, we do have helplines available for people. Oftentimes, however, you can imagine there's a lot of people calling in asking those questions, and that's where we find that using the sites that we've recommended in the past are maybe not the quickest, but probably the most convenient way for you to get the information that you're looking for.
Thanks for that answer. Thank you for the question from Gretchen. We've got our next one coming here from Mickey in Green Acres, who's asked me to read it. Question is, what are thoughts surrounding caregivers coming into the home for the elderly and exposure to a vulnerable population? Thank you for the question, Mickey. Who'd like to take that one on?
This is Bob Lutz. Again, I think, as I mentioned earlier, we've been very proactive at reaching out to caregivers, providing guidelines on what they need to be doing, encouraging things like taking temperatures, looking for symptoms, and using all those efforts that we know can protect people from contracting the illness. So again, I think that any caregiver out there is obviously caring for those individuals, and they know and have been provided the guidelines on what they should be doing to protect those individuals they're caring for. Thank you.
Thank you, Doctor. We've got our next one coming from Ted. Hey, Ted, you're up.
Hello,
Thanks for waiting.
Ted. Hello, this is Ted from Hilliard. My question was partially answered earlier. My concern is for the construction industry. I have a son that lives in Coeur d'Alene, and they're having a house built, and they're working over there. And it seems like we should be working here. Certainly they could exercise social distancing and still stay part of our economy.
Hi, this is State Senator Andy Billig. Thank you for that question. That is a question and a concern that we've been talking a lot talking about a lot. You know, there are so many businesses that have contacted my office and the governor and probably every elected official who's here in this room to say, but our business should be an essential business. And individually, they all make a lot of sense. The concern is if you let all of those businesses be essential businesses, then we have the potential to expose more people, which could actually lengthen the health crisis and slow the economic recovery. So it's about getting this balance right. And that's why I think the governor has taken a cautious approach. With that said, I think there is room to loosen up. I think housing is sort of an obvious first step. And as we see the decline in cases, which is hopefully going to hold up and continue over the next period of days and weeks, I think construction should be one of the first industries to come back online. And so I appreciate the question very much, and we'll keep working on it. Thank you.
Thank you again for the answer. We've got our next question coming right away from Denise in Spokane. Hey, thanks for waiting. Denise, you're up.
Okay. Hi there, everyone. I just wanted to say that I do think that there was quite a bit of leadership failure on you guys' part, because we knew that Washington State was ground zero. So we knew that in advance. And here I was, sick, diagnosed with bronchitis. Most likely it was coronavirus, and I could not get tested. I was told I had to wait in my car in 29-degree weather for 2 hours at Chaz before they would see me. There were no tests available. There were no tests available at the at the urgent care. And I feel like it would have been nice if you could have been doing these town halls maybe before. It would have been nice to know how the local leaders felt and that they knew what the issues were. I didn't get that from you guys, which really left me concerned. So there's no telling, I have no idea how many people I probably spread coronavirus to. Back in February, might I add. Anyway, I just want to know, I wanted you to know how I felt. And I really hope that you guys, you talked a lot about all the discussions you had with each other. What you didn't do is you didn't get on TV and let us have discussions with you like we're doing right now, which I think is really beneficial. So I'm just asking, I hope you learned from this, because we knew Washington State was ground zero. The federal government and state government also has accountability, don't get me wrong, but you're our local leaders. We're local, we're family. So I just ask that you please do learn something from this. Thank you very much.
Ma'am, I certainly hear the angst, and I appreciate that. Trust you me that this was a challenge for us in public health and in the healthcare community for quite some time. I think it does, unfortunately, speak to the limitations that we had in supplies. You've probably heard me saying for quite some time that I really believe that we were having people who were symptomatic, people who had the infection in the community. The rate limiting factor was that we didn't have the means by which we could test people. So yes, we were ground zero. I have no doubt that we had people in our community based upon traveling across the state that were COVID positive. I just couldn't make that diagnosis. So again, I hear where you're coming from. My apologies for the limitations in the system. I do hope that if we're confronted with this again, we can and will do better. Thank you.
Thank you. Thanks for your question, Denise. The next one's coming up from Dale. Dale and Chatteroy, you're up.
Hi, I'm just directing this to whoever would like to answer this question. As our curvature is flattening out in the state, does anyone in our state have a plan on to get us back to work before we implode and civil unrest starts happening in our country? Okay.
Thank you, Dale. Who'd like that one from Dale and Chatteroy?
So this is Commissioner Al French. Not
not aware of any plan at the state. We do know that there are financial resources and other resources that are coming our way, and as we get better clarity about quantity and guidelines around that, we can shape that plan. As I indicated in the opening remarks, we as a community are coming together to create that strategy to be able to come out of this crisis and get our economy standing back up. Our goal is to get the most number of people back to work as possible, and so it's using those resources strategically to energize different sectors of the economy so that we can get everybody back to work as soon as possible. So we're going to create that plan here locally. No one's coming to help us. We got to help ourselves. And your leaders, both in the business community and elected leaders, are coming together to create that strategy.
Thank you. Much appreciate the answer. Thanks for the question, Dale. We'll get our next survey question up, then we've got Lonnie in line after that. So Lonnie, hang tight. We'll get to you in just a second here. First, we've got another survey for our audience. We want to know, in the last 3 weeks, have you experienced any of the following impacts? Press 1 if you've experienced concern about availability of food and or household supplies. Press 2 for loss of employment. Press 3 for stress from disruption to daily routine. Press 4 for anxiety over maintaining connectivity to friends and loved ones. And press 5 if it's a combination of the above. So again, in the last 3 weeks, which of these things have you experienced? Press 1 for concern about availability of food and or household supplies. Press 2 for loss of employment. Press 3 for stress from disruption to daily routine. Press 4 for anxiety over maintaining connectivity to friends and loved ones. And 5 for a combination of the above. Thank you for voting in that poll. We'll have another one in just a minute here. First, let's get our next live question up. We've got Lonnie and Hilliard up. Hey, Lonnie, you're up. Go ahead.
Hi, yes, I'd like to know about the unemployment that they're giving a $600 a week bonus for people that are laid off or not working from the coronavirus. Well, my question is, what are they doing about the people that are still working but are only working half of what they would be working if the coronavirus wasn't here?
Thank you very much.
Lonnie, great question.
Yeah, thank you very much for that question, State Senator Andy Billig. And there are benefits available, and it would depend on the specifics of your situation, but being underemployed or losing hours due to the coronavirus or even other factors can qualify you for unemployment benefits. So I encourage you to go to the ESD, that's the Employment Security Department for Washington State website, and it's very easy to navigate. You should be able to get your questions answered. If not, there is a number that you can call, and you very well may be eligible. I'll say generally on unemployment benefits, the Employment Security Department has seen an increase of over 3,000% in claims. And this is unprecedented. So they are doing their best to go through the claims and get people qualified for benefits and get those benefits flowing, and they are doing so. One of the things as a state that we've done is we took away the 7-day waiting period, which used to be if you qualified for unemployment benefits, you had to wait for 7 days after you were qualified for those benefits to flow. That is no longer the case, so the benefits can flow faster, and the federal government has helped us out as well by relaxing some of the requirements and providing some additional resources like the $600 increase in maximum benefit that you mentioned. Thanks.
Thank you, Senator. Thank you for the question, Lonnie. We've got our next one up from Michael right away. Michael in Spokane, thanks. You're up.
Yeah, thank you. Say, first of all of you are trying your best in this difficult situation. My question is, what is being done now to help those in homeless shelters or the poor in this Corona-19 situation?
Spokane Mayor Nadine Woodward, thank you for that question. We get that question a lot. We had the challenge of trying to find overflow capacity for our vulnerable population as we implement social distancing in our shelters. An early assessment indicated that we would lose about half of our beds. And so less than 2 weeks ago, we were able to open up the downtown Spokane Library, which was vacant because of renovation, and we were able to locate 100 of our homeless there. It has worked out quite successfully. We have 40 women from the Hope House, operated by Volunteers of America. We have 60 individuals from our Cannon Street warming shelter. We are also looking for more overflow capacity, as we may find more people who need a bed. Going from 6 inches apart, whether it's a bed or a mat, to 6 feet really has been a challenge. And I want to thank the Health District for helping us in our shelters being able to do that. So I think we're doing a really good job. One thing I can say that I'm very happy about is that we have not had a confirmed COVID case in any of our shelters with the individuals or even the staff members. So that is a small success for right now, but I'm very happy about that. I will say we have been able to stand up an isolation in a quarantine facility for our homeless population out at the fairgrounds. That is just about ready to go. So we are working on that, and so far so good. So thanks for the question.
Thanks for the answer, Mayor.
All right, we are going to take a quick break from the Spokane County Question and Answer Town Hall right now, trying to answer questions from within our community about the local response to the coronavirus.